Hello again. I'm going to talk about continuation of lung transplantation. And last time I talked about about lung transplantation. This time I'll be talking about the same thing, though a little bit more on the side of the donors. So I told you about the lung transplantation and the contraindications for the lung transplantation. It is very simple to understand that if a recipient is older and has a cancer and has a bad diseases, it would not be a good candidate for transplant, as other disease will cause and contribute mortality and morbidity. So any kind of long-term infection like Mycobacterium avium or atypical mycobacteria or TB would be a relative contraindication. Untreatable coronary artery disease which cannot be corrected by surgery or by stents or angioplasty, etc., would also be a relative contraindication. Presence of any cancer. Of course, people may have death due to cancer, and then the transplanted lung, the surgery, the expense, and the donor's lung would be wasted. So that would be a contraindication. Any other organ dysfunctions like liver, brain, like strokes, kidney disease, these also are relative or transplant contraindication for the recipient. Please note that we also consider obesity. In obese people, the mortality after transplant is much higher subsequently. Obesity relatively is considered as a contraindication. People are encouraged to lose certain weight and bring down the BMI to about 30. Presence of HIV, hepatitis B, hepatitis C certainly would be contraindicated for the transplantation. Age is another criteria, though it is relative. 65, 70 is considered as a contraindication beyond that. In the past, we used to do only 65. Now we do more than 65, but maybe 70. Psychiatric disorders, major ones, would also be a relative contraindication. And same is also with the bleeding problems of any kind of coagulopathy, not related to, of course, the drugs that are used. So these are the contraindications. We talked about these before. We also talked about the major indications where COPD, pulmonary fibrosis, alpha-1 antitrypsin deficiency, cystic fibrosis, pulmonary hypertension. These are the major diseases where transplant of the lung is considered. So the indications are clear. The relative contraindication and absolute contraindications are also determined. Now we're going to talk about donors. It is interesting that most of the people know about the indications and relative contraindications for the lung transplantation, but have no idea how the donor is selected. And unfortunately, in very short, somebody has to die to give an organ in this case. Contrast to kidney, where a cadaver kidney can be transplanted easily, and contrast to kidney, where even live donors have also given a kidney. Live donor lung transplant is very rare. When it is done, it is only a lower lobe transplantation does as a lower or segmental transplantation, and that is very uncommon because of obvious reasons. So we also talked about bilateral versus unilateral lung transplant. More and more bilateral lung transplantations are done. The survival is better with bilateral lung transplantation. Certain diseases make us do the bilateral lung transplantation nowadays than single lung. Now coming to the donor criteria. There are two major things that I could say about the donors. One is that brain dead donor, so everything else is okay, but for whatever reason the brain has died, whether it is because of hypoxic brain injury from, say, drug overdose or major strokes or something like that. And the other one is where it's called DCDD, that means basically the circulation has stopped. So when a patient is brought to the ER and is dead on arrival, that would be group 1. somebody who has a unsuccessful cardiocirculatory resuscitation, somebody who has a cardiac arrest while he's in the hospital, and somebody who has a circulatory failure and clinically non-sustainable would be also considered in that group. So basically, when CPR has failed or somebody is DOA on arrival, that would be the criteria for the group 2. Again, the criteria for donor's lung to be transplanted, the size of the lung is an important issue. Sometimes an emphysema recipient, the chest is bigger and can adapt to a larger transplant. Pulmonary fibrosis, on the other hand, is a smaller chest and cannot tolerate larger lungs in those cases. The contraindications for the donor is kind of a little bit different than indication. So the age of 55 or less is preferred. Age of 60 has been tried as an additional criteria to acquire more lungs. Diabetes makes it more morbidity. The presence of infections, CMV, hepatitis, HIV would be a relative contraindication or contraindication. Smoking history of more than 20 years is also a contraindication. This is primarily because we don't know the function, and secondly, if there is a presence of some cancer that is not obvious on a plain radiograph, may become a problem if that lung is transplanted. Sometimes when there is a slight abnormality in the one lung, people have transplanted in the other lung. Atelectasis is another criteria. However, people like to see the oxygen, and on 100% oxygen, if the donor has PaO2, arterial oxygen greater than 300, then it is accepted. So also the blood group compatibility is also very essential. Blood group matching versus blood group compatibility are the two different issues, and both have pretty similar results, though in the past people have been using only blood group identical transplant, but blood group compatibility has been also used. So the donor criterias are preferably less than 55, sometimes less than 60, and brain dead or circulatory failure. Those are the two criteria that are used. And the acquiring team is informed and they make the final judgment. Please note that these criteria are established, and somebody had asked me about how lung transplantation list goes. And there is an allotment scores. Higher the scores, you're on the top part of the list. And the expenses also, unfortunately, depend on whether your lung allotment scores are higher. That means you're more sick, then the expenses are more. Just to give you a base idea, is about 150, 160,000 is the base expenses for the lung transplantation. When the scores are much higher, because the procedures and the dependency on ventilator and other stuff is increased, the expense can go up to 300,000. This is in the United States. I don't know the expenses in India or any other countries, but this is what usually. So you're looking at about 160,000 to about 270,000 as an expense, depending upon how sick you are in the beginning part of the post-transplantation. And before transplantation, if your needs were very high, lung allotment scores are very high, then the expense is higher. So more than 75 score, expense is close to about 270,000. Less than that is about 160,000, 170,000. This is very general information. No specific can be given. you will have to contact the lung transplant center. Thank you for watching. Have a nice day. Please subscribe if you like.